I am Dr. Kuldeep Kumar Grover, consultant pulmonologist and intensive care expert at CK Birla Hospital, Gurugram. So, as the third wave of COVID has recently passed, so many patients we have treated and came to our OPD with respiratory problems. So recently we are still getting so many patients who are having breathing difficulties and all respiratory problems like cough and other constitutional complaints. So I am going to tell you about most important topic, what all are the breathing exercise to improve our lung capacity so that we will not feel breathless all the time when we are doing office timing or at our home also. So as we all know, these breathing exercises are very much important to keep our lungs healthy. So what is this lung capacity? So your lung capacity is the total amount of air that your lungs can hold upon. So normally this total lung capacity gradually wanes as the age passes on. As the age passes above 20 years, so this lung capacity is gradually waned slowly over time as your lung capacity index is gradually getting decreased. Some diseases like COPD and asthma, this gradually increase the process of weaning of this total lung capacity over time. So you will be having more problem of this breathing and respiratory breathlessness. Unfortunately, there are exercises that will help and maintain this lung respiratory functions and capacity that are very much helpful. If we are making a routine to do these exercises at home, these are going to help us in allay our anxiety as well as our respiratory problems. So pertaining to these breathing exercises, there are about 3-4 types. First is diaphragmatic breathing, other is pursed lip breathing, third type is nose breathing, fourth type is box breathing. So these all kind of breathing exercise I am going to tell you that will help you out. So because so many patients we are getting every day, we are doing so many tests, they are complaining of breathing difficulty while walking on stairs, while at rest also. We are doing tests and ultimately all results have been come out to be negative. We are giving some over-the-counter drugs on prescriptions also, but patients are not getting relieved of their breathlessness. So ultimately we have to tell them all these breathing exercise to follow at home. So ultimately they are going to get benefit out of it. So what all these exercises are, this is very important to learn. The first exercise is, it is a diaphragmatic breathing. It is a simple exercise. You have to just sit relax on a chair or on a couch. So you put your one hand over your tummy and one hand over your chest. So you have to deep breathe your hold through your nose. When you breathe through your nose, your tummy will be moving out when you will inhale. So let the process go on smoothly. You have to do this process slowly while breathing through your nose. So put one hand on the tummy and one hand over the chest. So you have to inhale through the nose. And when you exhale, let the tummy and the chest move downwards. So as you exhale, this tummy followed by chest will move downwards. This is a repeated exercise. This is known as diaphragmatic breathing. Diaphragmatic is the main inspiratory organ of our respiratory system. If we improve the strength of our diaphragm, this is a major inspiratory muscle. If we make our muscles of our diaphragm much stronger, we will help in maximum respiratory problem as far as we concern. So this kind of diaphragmatic breathing we have to do as much as we can in a daytime or in a night time. Preferably during the daytime, it is very much helpful. If we continuously doing so at an instance, if we are starting it in an instance, we have to do at least 10-15 times in a repetition. So if we get tired, we have to hold for a while, then we can switch over to this breathing exercise after 1 hour or two. but it is very much important. Whenever you feel anxious and whenever you feel breathless, you can do these exercises before visiting to hospital also, because this will help in increasing your respiratory health endurance. Second kind of breathing is pursed lip breathing. Pursed lip breathing is a type of breathing that is usually very much helpful in person who are already having respiratory problems, like in a patient of COPD or asthma. So for practicing this pursed lip breathing, we have to purse our lips as we are blowing on anything. So we have to inhale through our nose, and then when we are exhaling, we have to exhale to, like in a process as we are pursuing our lips or like blowing on anything. So we have to inhale and then purse our lips, and slowly we have to exhale. Exhalation process should be more twice long as compared to the inspiration process. So expiration process should be slow. So if we are doing this pursed lip breathing exercises at home, this will increase our respiratory muscle strength, because if we are blowing out slowly through our pursed lip, the air will continuously accumulate into our respiratory system. This will increase our respiratory muscle power, and gradually more and more respiratory muscle exercises would be happening through these exercises. At an instance, you will be able to do as much as 10 to 15 time reps of pursed lip breathing. That will help you out in episodes of shortness of breath that occurs repeatedly while you are walking or while at rest. If you have any query related to respiratory issues, you can contact our website or visit in person to our center. Thank you very much.